you start to hear these buzzwords and they become familiar because you hear them more and more. And CBT was one of those things.
CBT stands for Cognitive Behavioural Therapy, and it's a talking therapy. So CBT for psychosis is aimed at helping people deal with unusual and distressing experiences like paranoia or hearing or seeing things that other people perhaps can't. And it involves working with a trained therapist to help you kind of make sense of why you think the way that you do, and also helps you to perhaps look at the way that you do things and perhaps doing things a little bit differently so that you can be living the life that you want to be living.
CBT to me is a way of training your mind to think in a different way, not to panic and to think things out.
It's a psychological intervention that has increasingly amassed a lot of research over the past couple of years as one of the most effective forms of therapy.
It might take place in your local team's offices, it might take place out and about, or it might take place in your home. Typically you'd meet for about an hour. The amount of times that you would meet would really be dependent on what you're working on. If you're working on something like sleep or self-confidence or worry, you might see a therapist for 6 to 8 sessions. If you're working on more kind of complex, long-standing problems, you might meet for up to 6 months.
And I think we did a 6 or 8 week course. It was once a week. We had a workbook and the therapist would ask me questions maybe about how I was coping that week, anything that I wanted to bring up, and also talking about my voices and how they'd affected me. And we discussed perhaps better ways of thinking and dealing with them.
It was offered to me via my caseworker and psychiatrist. We had a meeting together. It was really interesting. I think that I've still held a lot of certain principles. And so once we've tuned into this realization that we've got these negative thoughts that are just going to come left, right and center like fireworks, they're on trial. And who are they on trial with? They're on trial with all of yourself. So what are they saying that has integrity? What are they saying that is potentially true? But more importantly, what are they saying that you know in other parts of you can test and put on trial as being false?
It gives you a chance to sort of offload your problems to somebody that's there to listen. It also helps you to get things in perspective. I used to really panic if I went shopping. I used to feel that everybody was looking at me and talking about me. But when I've done the CBT, I managed to sort of get my mindset where I would calm myself down and say, no, they're not looking at you, they're not talking about you, they're just going about their business. Just not to jump to conclusions, really. If you're in the right frame of mind, if you accept that you do need help, then go for it. And also be prepared for it to, bring up some emotions. That actually helps you because you want to talk about what's going on in your head, and to get it out is a good thing.